All right, welcome everybody to this Monday afternoon. Thanks for being here. My name is Melanie Riddle, and I am with the Minnesota Office of Emergency Medical Services, and this webinar will focus on the OEMS Ambulance Service Training and Staffing Grant. All right, so the purpose of the grant, overall, address EMT workforce shortages in Minnesota. Support Earn While You Learn recruitment programs, such as what all of you can set up if you don't already have it. And the goals of this funding from the legislature was to make EMT training more financially feasible by providing paid on-the-job training, to attract diverse candidates, and to strengthen the EMS readiness within the state. I'm going to keep my chat up just in case. I'm assuming everybody can hear me all right. Forgot to check in on that. So the overall applicant eligibility criteria is number one, you must be a licensed ambulance service through us. And then at least 50% of your staffing was by EMTs. And there's two different ways you can meet that requirement. One is the roster-based requirement, where at least 50% of the EMS personnel listed on the service's e-license electronic roster are certified at the EMT level. And then number two would be the response-based requirement, where at least 50% of the EMS responses during the previous calendar year, as reported in MinStar, include an EMT listed on the patient care report. So you would just need to basically self-select which of those options you're choosing to meet that eligibility. And then over here, we will review all of our data and reports to ensure that you do meet that minimum 50% of staffing by EMTs. All right, so there are $2 million available for this funding over the next few years. Depending on how many applicants and how this process goes, there could be a second round, but just we have $2 million available for this project. And then eligible expenses are broken down into 4 categories: the EMT education program tuition, the EMT certification exam fees, any background study fees that are required, as well as wages and benefits up to the maximum of $26 an hour. There's no minimum, so if you have any full-time or part-time staff that you would like to enroll in this program, that would be eligible as long as they do not exceed that maximum threshold of $26 per hour. And then benefits are just based on the benefits they elect and you offer. And the grant period will be from January 1st to December 30th of 2026. And then kind of going straight into the application components, the assurances and signed cover sheet, Exhibit A. Let me back up. Let's go to, that's not the one I wanted. So on our website, we have the full RFP document, which we're basically reviewing today, and then the key dates, and then the important application materials are all of the exhibits. So for all applications, we need Exhibit A, Exhibit B, Exhibit D, and then these other ones we'll talk about more. But we'll start with Exhibit A, the assurances and signed cover sheet. Typically, these are things that you see within the Minnesota grant contracts. We're preloading them, so to speak, to you're signing them in advance with your application. So in the event that your application is approved and you get to receive funding, you've already signed that you agree to all of these terms. So that's kind of why it's a really important component of the application. And so that you actually do review all of these and agree to them. One important thing here, just to note, the use of funds, there are some individuals who may not be covered. I just wanted to highlight that so that you're just aware of, like, you know, if you're submitting reimbursements and everything, these would be the cases where an individual would no longer be eligible to receive the reimbursement through the grant. And then kind of the brief overview, our reporting per the state allowability of cost. Again, I already went over that with the 4 categories. Again, simple in the way that there's 4 things and that's it for this grant. And then at the very end of it is that cover sheet. So making sure you fill all of this part out, and then the official with authority is the one that would need to sign this. And so that can be through a verified e-signature or an actual wet signature, but not just like a picture or doing the sign that's not verified with the PDF. So it just needs to be an actual e-verified signature or a wet signature and then scanned in. And then another piece from that same web page that we were just on is the link to apply. And hopefully everybody has been able to access that and kind of navigate through it. I'll kind of walk through this. I've pre-put in some answers because a lot of them are required. So if you're trying to go and see what's ahead, you do have to submit things. So this submission checklist is just for you as the applicant to kind of review and make sure. Again, I've highlighted the ones that are required. This application narrative questions are embedded in the online form. And then these would be the exhibits that need to be uploaded. And then if you were doing requesting more than either 50,000 exactly or more than 50,000, we would need these other exhibits as well. With the exception of if you are a tribe or a governmental organization as your governing structure, then you don't need to submit F or G. All right, there's that eligibility piece. And making sure that you do select the correct one here. As I mentioned, they do kind of change the form and what needs to be filled out. So if you are a nonprofit, you would need to submit an additional exhibit, as well as if you're a for-profit or if you're the governmental county, city, or joint powers board, and then a tribe. This is where you're going to put in the total grant request. Also, so if you put in 49.9, it's going to change the rest of the form to not require those additional documentation. So just making sure that whatever you enter in here does match what you're requesting, as well as your budget and everything, work plan that you upload. One thing here, this is that important. This is going to look exactly like what I just showed you on the cover sheet and the assurances. We're just taking it electronically, but we do need that signature on that attachment, which is why it's kind of like the information is here for us, as well as then you upload your file here so that we have that signature on file. One important thing, the SWIFT vendor number. If you have never heard of this, don't really know what I'm talking about. Let's see, which one, I think it's this one. No, wrong one. Well, we can do a quick thing. If we just type in Minnesota SWIFT, it's going to come up with the SWIFT through Minnesota Management and Budget. You'd want the vendor resources. And then from here, it goes over all of vendor resources. This is so that you can get payment. We need that number so that you can actually be paid by the state of Minnesota. And on here, there is a vendor registration link, as well as if your entity already has, if your ambulance service already has a user ID, but you would like a user ID, if they already have a vendor number and you would like a user ID, there is a create a new user ID link. Just those are the kind of the 2 things. And just so you know what, if you're in the right place and what it looks like. Then you also can, this is kind of what the portal looks like, and then you would actually want to sign in once you had that. But making sure that you request that in, I would definitely do it today if you haven't already. It sometimes takes a little bit of time, and it's not anything that we control, and I would want you to have that so that you could apply when the deadline comes. So that is a required piece, and you would put it right in here. And then we get to those narrative questions, which again is that kind of big component that's also required. And, I recommend they're in the RFP, but also if you review this page, want to take the time, work on a separate document so that you kind of have time to work on your responses. And then, there is a way once going all through these, the save and resume later. You can save and get a link. You would need to keep that link, and it does prompt you that. It can be emailed to you, and it will only, so for instance, if I do it now, I've filled everything out, it should save it. But just for some reason you have multiple links, you would want to use the most recent link. Otherwise, you're going to see a previous version, and you'll be like, where did everything go? So just a note on that for this system. And let's see where I wanted to pull one other piece in here. This piece, just make sure you answer that. I believe most people should be able to answer yes, but just wanted to highlight that, making sure, because it is very broad in what kind of population data we're looking for. All right, so then your other required, the work plan and budget. This is where you're going to be uploading it. And work plan, pretty simple. Please do one goals and objective per line, and then kind of the tasks and duties and deliverables that would align with that. Your evaluation plan, the overall expected outcomes, and then the timeline. This could be from, January to February, January to March, or from January to December, or you can, submit the actual dates in there as well. Whatever works for you, as well as your work plan. And then the required budget. This piece needs to align with your work plan, so making sure that whatever you put in here, it doesn't seem like, I don't know how you got these numbers, making sure that those two align with each other. And then just an example for you, making sure you put the grant period in at the top, and then however it works out for that. And then there is a budget key for your review if needed, as well as the work plan definitions, just as you're working on it to try and make that piece a little bit easier. So once you have that saved and figured out, making sure it's uploaded into here. And also just a note, because I've seen applications in the past where they have uploaded the wrong document to the wrong place. So just double checking that. I know it seems a little silly, but it really doesn't help out in the long run. All right, now we get to the required documents. So I'm going to go back to here. Again, the Exhibit A, which is the assurances and cover sheet, Exhibit B, which is the work plan and budget, and then Exhibit D, that one over. This one is required, just certifying that your ambulance service is not suspended or debarred by the state of Minnesota or the federal government. And so we also do a review, but basically we need you to attest that that is the case and to upload this form. All right, for any applications, $50,000 or more, we would also need these other attachments. So Exhibit C, Exhibit E, Exhibit F or G, and then Exhibit H. And these are all, again, are available on our website, and reach out if you have any issues accessing them. So Exhibit C, the performance capacity. Just in this area, we're looking for just a brief overview of how large is your entity? Like how can you show that you're going to be able to manage handling the grant, both in the administration of it as well as receiving those payments. And then if you've been awarded a grant from the state of Minnesota in the past 5 years, and if so, what became of that? All right, Exhibit E is evidence of good standing. So the Minnesota Secretary of State, if you are a for-profit or nonprofit entity, you do need to be registered if you're doing business within the state of Minnesota. All applicants are required to submit this. So even if you are a governmental organization or if you are a tribe, if you submit this piece, I would understand that that would be a no because those are not required for those entities, but we still need the form. All right, and then Exhibit F, if you are a nonprofit, we would also request that you submit your 990, your most recent one, with this form. It'll just make it a little bit faster for us to kind of process through the financial review. And those questions are pretty, just going through them and making sure the attachment is signed and good to go. And then Exhibit G, so you'd either do F or G. G would be a for-profit. And like I said before, those will not show up if you're a governmental organization or a tribe. But we would also be looking for the responses for this. And then Exhibit H is required for everybody. Sometimes there's some questions over who is the list of principals. It does define it here. So public official, board member, or staff member that would have the authority to access the funds provided by this grant opportunity. So if you're a nonprofit, all of your board members would be that, any staff working with the grant, and you would need to provide a list of those individuals that you, as the signer, are certifying that they have not had been convicted of a felony financial crime in the last 10 years. So that's kind of a description of that, and one of the required things regardless of entity, if you are requesting more $50,000 or more in the grant. All right, so criteria. This kind of speaks to everything that we just looked at in the application itself. We're looking for the program need, the long-term plan, the sustainability of the EMT workforce, kind of like how does this impact, and how will this benefit your ambulance service or your area? The recruitment and selection plan. Do you have a plan? What is that plan? And then the service readiness. So that goes back to, do you have the capability of handling the grant funds and the grant management process? And then also the location and service area will be considered as well. So total possible points, 100. That cover sheet and assurances, I hope everybody can get. It's 10 points by just completing it and uploading it. The project overview, that will be scored up to 20 points. The service readiness and need, 20 points. The work plan and budget, that's going to be your biggest ticket item with 30 points. And then your project impact with 20 points. And this is where our group of grant reviewers are going to look at and kind of score all of these based on, how the response is, and is there enough detail, and is there a plan, and kind of all of that. So timeline, you're here today. And then if you have any additional questions, you can email them through Wednesday, October 8th at noon. And then I will have responses. I've received some already, and those will be posted on the website with the written responses. So if you just had anything additional that you don't have answered today, or anything that comes to you in the next day or so, feel free to email, and we will have those posted and responded as well within the email. And then application deadline, it is Friday, October 17th at 4 o'clock. Ideally, you're doing it in the morning at the latest. I've definitely done lots of grants, so I know that you take it to the wire, but just to make sure there's not any technical difficulties or challenges with actually submitting your application, I would recommend trying to do it that morning, if not earlier, to just make sure it was received. You will receive an email that shows all of your responses, as well as there will be something you can screenshot after you submit it that shows the time and who submitted it. It's got some things in there, so that will kind of make sure that you know it was received. You should receive an email and see something on your screen. So if you don't, we did not receive it. Try again. The anticipated award notifications will be in December. And again, that looks like after we do all of our review, we're going to do the financial review in November, as well as start the grant review process with the grant reviewers. And then we're hoping to have the anticipated award notifications go out in December. Again, so you would have time to actually start the grant, start the program in January and then through December. You don't have to take up the whole grant period, but I definitely recommend a year seems a pretty good time. And I'm trying to think if there's anything. I don't think there's anything else with that. So The process, the first thing will be the screening. So when you submit your application, we will be reviewing it for do you meet that eligibility criteria? Again, two things, the 50% EMT staffing as well as being a licensed ambulance service. And then do you have a complete application? So did you fill out the entire form? And did you add all of the required attachments and exhibits? So that's kind of like, if you don't, you won't move on to the next phase and you will be notified of that. Hopefully everybody does, and you go into the reviewer process. That's where the scoring happens. We do have a competitive review committee of community reviewers as well as some staff. And then we will kind of compile all of the scores, kind of figure out who's on top, who's down at the bottom, and then we will do the risk assessment. So that's where the financial documents are important, and reviewing operational capacity. At the state of Minnesota, it's often called the PARA. It's a pre-award risk assessment, just if you've heard that term before. And that is just what I said. It's reviewing the finances and making sure that we're doing the due diligence with taxpayer dollars. And then the final decisions based on the risk assessment and the scoring will be made by the OEMS director. So as that's just kind of the flow of the review. And then kind of just to give you an idea of what the award management and, what are you signing up for? There will be a monthly reporting and invoicing. This will start in February of 2026 and run through January of 2027. Just a reminder, the funds are limited to training and staffing and that there are no admin or travel costs reimbursement eligible. And then that compliance with Minnesota statute and policies, that is in regards to kind of the grants management policies, as well as the statute that allows us to offer this funding from the legislature. And to give you an idea of what it actually looks like. So submitting the invoice and the progress report, it's going to be similar to you're familiar with submitting the application. You'd fill all this information out, upload the progress report, and then this is the actual invoice. So you submit these, it totals down here. There's 5 categories on here because I did separate out salary and fringe benefits, but again, it still is within those 4 overall approved categories. And here's a screenshot of the progress report. So again, this will be monthly and it would tie to your work plan. So thinking again of that like single goal, we just want a status of where it's at. Have you had any super successes or any major challenges? And then any additional notes or updates. So trying to make it simple, realizing that it's a monthly report, but that we have something that matches what you're actually invoicing for. So your responsibilities with this grant program would be use funds only for EMT training and staffing, maintain financial records, and then the monthly invoicing reporting that I just went over. So one more time, submission checklist, making sure that we're all clear. We need that Exhibit A, the signed cover sheet and assurances. The online application is completed. The work plan and budget, which is Exhibit B, fully completed. And then you need that Exhibit D, the certification of not suspended or disbarred, and then the additional exhibits if you're requesting $50,000 or more. Now looking over. All right, grant. What is the difference between the written questions and the application as a whole? Is the written question part of the 3 exhibits required for everybody? So the written questions are required for everybody, and that is what is in go back to that page. So the grant application narrative questions are required for everybody, and it's this page within the application in FormStack. So they are identified within the RFP, and you can kind of pre-see them. It's not anything additional in here, but it just breaks it out into the entries. So there's no attachment for the questions. It's just submitting them in here. And then I think now there's one in chat. Is FormStack the only way to submit these documents? Our IT department has blocked FormStack. Yes, that is how we have submitted that. I would contact your IT department to say I have an application that I need to submit, because they should be able to temporarily unblock it for you to submit an application. That is the way that we have set it up. All right. Well, I blew through that pretty quickly. If there's any other questions, I'm happy to answer them. Or if you want to see anything else you don't think I went over. If not, happy applying, and thanks for your interest in the grant program and the work that you do in Minnesota. And reach out again if you have any other questions. Happy to help.